In this video tutorial, we'll talk about what are the benefits of the digital space maintainer and we'll compare it with the conventional space maintainer. Before we dive into the actual topic, let us compare the manufacturing steps involved in the fabrication of the conventional space maintainer and as well as of the digital space maintainer. For the conventional space maintainer, we need to take the impression of the patient. It is very messy and very uncomfortable experience for the mixed dentition child. Then you select the band on the plaster model. Alternatively, you can skip this step and you can select the band on the mouth of inside the mouth of the patient, but that is again increasing the chair time. So for the mixed dentition child, the chair time is very important because of the questionable compliance and the importance of the treatment. That this treatment is very important, otherwise you will definitely have some malocclusion because of the lack of a space maintainer. So either you select band on the plaster model or you select band on the inside the mouth of the patient, but that increase the chair time. The next step is when you select the band, you try the band inside the mouth and you take the impression with the band in situ in the mouth. Then you take out the impression, the band is shifted into the impression, and then you will get the model having the band over the plaster model. Then it is sent to the lab and the lab manufacture the space maintainer and do the soldering work after the proper wire work. So a lot of skilled work is required on the part of the dentist and as well as on the part of the technician as well. The dentist has to take a very nice impression, especially the impression with the band in situ. And on the part of the dentist, the band selection skill is very important, because if you slightly over select the size of the band, this always be having some issue of decementation again and again and lead to a lot of other complications. So skill is required on the part of the dentist, and on the part of the technician, he has to be very good in the wire bending, in the soldering, and in the polishing of the lines as well. So then you always have the issue of decementation and periodontal problem around the band, because sometimes space maintainers are given for 3 or 4 years. So greater the time, greater all the possibilities of the failure of the solder joint, decementation, and most importantly the periodontal issues around the margins of the band. Now comes to the steps involved in the manufacturing of the digital space maintainer. You just take the scan, the intra scan of the half side will be enough, and you must remember to take the scan of the opposing arch, because you need to plan and you need to design the plans within occlusion. So you must be having the scan of the opposing arch as well, and that's going to take like 30 to 40 seconds. Just compare the difference of the taking impression of a child and 30 to 40 seconds involved in the impression taking process. Then the appliance is designed on a laptop, and it's a purely CAD/CAM process. After the designing, it is sent to the lab for metal 3D printing, and you get the appliance and you just insert it blindly in the mouth of the patient, because of your confidence of increased accuracy, fit, and precision in manufacturing of the CAD/CAM space maintainer. So only 2 steps are involved. You just take the scan, and on the next appointment you will be fitting the appliance inside the mouth. And you would, because you can keep the margins so much away from the gingival margins, that's why you do not have the issue of the gingival inflammation. The design is so smooth, comfortable, that it has no plaque-retentive side, just like in the conventional space maintainer that has the issue of the plaque-retentive side, especially in the soldering area. So as there is no soldering point, it's a monolithic single unit joint. So the joint failure because of the solder failure is not there. Improve accuracy, exact fit, and as per the literature, there is great acceptance of this appliance and more successful chances with the digital workflow in the manufacturing of the digital space maintainer. Thank you.